I do want to ask about, your first research aim being to draw on tokelau knowledge of culture and history and social environments. And you identify, which I guess must have been a difficult job, with all the interviewees that you spoke to in their stories, to condense the findings into sort of 7 key themes.
Yes.
Could you tell us about some of those themes?
I had to do the findings of each of the groups. So therefore, for the elders and the tokelauan leaders, significant findings of the way in which the environment was and how they were raised. It was utilising the resources that's already on island. And it was incredible to find out about Te Ngā Lahu, which is the tokelau oven pit, the waka malanga going out to the outer islands to provide the foods back to the kāinga. So there was different types of fishing methods, but that's for the tautei. But it indicated to me the whole way of life. And inati, which is a village distribution of food and resources. Also, like the different types of food, like wheke, having pulaka. These were local foods that was provided. So these findings were coming through. So, for example, they don't use the canoes in tokelau anymore. They use the outboard motos, the outboard motor boats. A lot of the findings was a whole lot of insights from the elders. So it's the kāinga and the village traditional way of living. So, for example, weddings back then, it'll be both families coming in to discuss the wedding, but now decisions are discussed. You bring this, we'll bring that, or don't bring this, or you bring this, or they don't even discuss that now. Whereas back then, everybody comes together and they work together for whatever resources is in their hands. Then they work together from that, and you have the beautiful outcome of a beautiful wedding. And that's like with funerals too, families always come together. So I had the tokelau adults. So these were the first generations, second generation, the New Zealand born. So they would share their stories of living here in New Zealand, but the way the parents still carried the culture, it was normal to live in houses of up to 13 people living in a 3-bedroom house. That was in the 70s and the 80s, and we would travel to visit family, and that's the sleeping arrangements. That's how so there was lots of insights from the New Zealand-born generation of their expectations with their parents, or the clashes, or even how the parents would support them throughout the schools, and to do with health and well-being. And one of the key things out of these 3 groups, obesity was never discussed, although the project had started off with looking at obesity and the way, but everybody kept talking about well-being. So we had to restructure the actual PhD in its course of what was actually in the data, because obesity can also be a deficit model, whereas well-being, it's more ora, it's alive, it's a holistic. And then so that's the majority of findings from the adults, tokelauan New Zealand-born adults, and then there was the youth, a dynamic bunch who, in their findings, I found them very strong advocates, and once they would get information, they would research a lot and see what would be beneficial for the communities, and quite outspoken on issues. And then the stakeholders. So it's the inequities within the systems that was coming up. The 7 key themes would be kāinga values, duty of care, which is tiu te tautua, and maintaining family relationships, whai kāinga, interconnectedness, which was he hokotakinga, and spirituality, which is o langa haka te anganga, health advocacy, and impacts of inequity. So that's how I had to group across the findings.
One of the themes that I was really interested in talking about it came under theme 1 of Kāinga, that you speak about collective identity as being really important to consider within healthcare systems, and how predominantly within Aotearoa New Zealand, healthcare comes from the sort of individualistic or biomedical point of view. But within that first theme, and everything you have spoken about is this importance of community and family and groups of people. I wonder if you could talk a little bit about that as a value and a theme, and how that is so important as when we think about well-being and holistic approaches to sort of healthcare, that kind of idea of collective identity and family was something that shined through the interviews.
Yes, absolutely. It did shine through a lot of the interviews. Every participant, the principle is kāinga values, looking after your kāinga. And see, with going through the research and writing up the discussion chapter, the findings is like the collective orientation is a strength in many of the cultures and Indigenous populations, like, for example, Māori, First Nations, Canada, and those of Pacific. And there have been significant wealth of literature written up by scholars and academics. And they literally note, for example, the definitions of health, which emphasizes spiritual, physical, and holistic dimensions. And so the core components linked in collective orientation is identity. And so taking a collective approach is a pragmatic approach. For a kāinga approach, it's a pragmatic approach. And also it gets the community to take ownership of their health and the programs. And that's the benefits of working together with the communities and its values, especially the Pacific values, to be able to recognise that that's how we operate, and that's our kaupapa, that's how we roll.
And one of the themes that you talk about is interconnectedness, and I'm just thinking about the stories you told of your time working on tokelau, all of that interconnectedness and the contribution that everyone plays within a sort of healthcare scenario.
Absolutely.
Taking that framework that you experienced and then applying it to the New Zealand lens.
Yes.
And you speak about this importance of engaging and working with communities, kind of localized levels rather than a top-down approach. I can absolutely see how those stories from tokelau, when you compare that to experiences of working and observing the healthcare system in New Zealand, there's a big difference in terms
huge
of
difference.
how interconnectedness plays out within that system.
Absolutely. We went through a blood transfusion situation in tokelau, and I observed the doctor and how he worked, well, myself and the doctor, but how the doctor worked with the kāinga and the donor. So in haka tokelau, what we had to do as the working in the hospitals, we had to look up on the register, which was taken in the early 1980s, and at that time it was 2002. And it was the register had the blood types, and it was done by Dr Elekana Whāwhoi in his time. However, we could match the year of the person if they were still on island or not. And what we were looking for is a strong tokelauan young male in their 30s who can come and donate blood. And I watched the ethics approach, how he explained, fully informed the kāinga and had them all coming in. And the kāinga is the patient's family, along with the patient. So they brought the Dr. Te Kia Josefa, brought the whole kāinga in together, and he fully informed them of what the process is, what the diagnosis is and what has happened. And then he informed them that this is the best way that we would have to do it, and it's the blood transfusion. And then he also had sent the porter to go and look for the donor and to bring the donor in and fully inform the donor. And then along with the kāinga to say to them, are they okay to have this donor? Because we've blood cross-match them. And the kāinga are really, really happy that the donor has. And the donor was like saying, he can take 2 pints. I can give 2 pints or 3 of blood to help him. And you see the aloha of a tokelauan right there unfold itself. And for me, it was incredible because I come from an institution where I was trained in hospital. Every ethical legal responsibility is all on paper. You have to read it out, and you read these complex words to your patient and they have to nod. They either nod, just do what the doctor, just do what the nurses say. But what I saw in this process, an incredible, well-informed process. They're not rushed because of the time. They're not rushed to, but they're fully informed. So that's what I mean by interconnectedness. It's the presence of the doctor being able to have that face value. I mean, when you go to the GP, you're only given 30 minutes. 30 minutes to tell your story. And that's what they call primary health.
Thanks for watching PhD Unpacked. If you enjoyed that little snippet and you want to watch the whole interview and have access to a whole bunch of extra stuff surrounding the PhD Unpacked project, head over to Patreon and become a patron. Patreon.com/PhD Unpacked.